Rational Emotive Behavior Therapy's Perhaps Most Difficult Skills, Part 2. This is a continuation of Part 1 of a video with the same title. Clients do not know that we REBT therapists are often trying to identify our clients' inferences and beliefs, to better help us find ways to assist the client to overcome their dysfunctional inferences, beliefs, and behaviors that interfere with the client's ability to reach their desired short-term and long-term life goals. If we are seeking the client's beliefs about a particular situation, we might ask the client something such as, "What were you telling yourself about that situation when you experienced anxiety?" The client might respond with an inference rather than a belief. An example might be as follows. 1. The therapist asks the client, "What were you telling yourself when you failed to pass your doctoral dissertation defense that caused you to experience depression?" 2. The client might respond, "I told myself that my parents are going to be very disappointed." Notice that the client responded with an inference rather than a belief. It is an inference because it attributes a specific meaning to failing to pass the dissertation defense. 3. This is where the therapist does an inference chain in the hope of helping the client identify a belief rather than the inference. With that aim in mind, the therapist accepts that the inference is true whether in reality it may not be true, and then proceeds as follows. The therapist says, "Let's say that your parents do get disappointed about the fact that you failed your doctoral defense. What would you be telling yourself about that which would cause you to be depressed?" 4. The client might then respond, "That would be horrible." Since the client's thought evaluates the parent's disappointment as horrible, it is a belief. Once the therapist has identified the client's irrational belief about his parent's emotional response, the therapist can employ disputes to help the client eventually replace the depression-causing belief with a more adaptive, helpful rational belief. Notice that the therapist can only use the inference chaining to move toward identifying and replacing the irrational belief, if the therapist can distinguish between an inference and a belief. I have seen what happens when the therapist can't or doesn't distinguish an inference from a belief. Often the result is that the therapist disputes a cognition that does not cause the dysfunctional emotions or behaviors. This may be confusing to the client and ineffectual in bringing about cognitive restructuring. Let's return to the fact that both inferences and beliefs can be dysfunctional. Inferences can be dysfunctional when the client holds an inference as true when it is false. Beliefs can be dysfunctional because they are exaggerated evaluations about self, others, life, and the world, and which yield dysfunctional beliefs and behaviors that disrupt life and may cause needless pain and suffering. Comprehensive REBT treatment involves helping the client change dysfunctional inferences and beliefs to ones that are adaptive and functional in the sense that they help the client be free from emotions and behaviors that impede the attainment of desired life goals. How might we help client replace dysfunctional inferences? Here is one. A client who experiences anxiety has an inference that is attributing threat to a situation or event. Many highly anxious clients make an attribution that the threat is overwhelming. So, one strategy would be to help the client be more accurate in the attribution. This may involve helping the client realize that the threat, even if real, is not overwhelming, but manageable, or perhaps even a mixture of threat and opportunity. This moves away from dysfunctional black-white dichotomous thinking. There is much written about how to dispute or challenge dysfunctional beliefs. REBT holds that dysfunctional or irrational beliefs fall into 4 major categories. They are 1. Demanding beliefs, which rather than preferring a situation or event be a particular way, actually demand that the situation, event, self, and other be a particular way. In English, words that typify a demand are should, ought, must, have to, and need. 2. Awfulizing or catastrophizing, such as, "This is terrible, horrible, or awful." 3. Frustration intolerance, such as, "This is overwhelming, too much, or intolerable." 4. global negative rating of self, others, or the world, such as, I am a total loser, you are no good, or life is a meaningless mess. The types of disputes of beliefs are 1. Functional/pragmatic. 2. Empirical. 3. Logical. 4. Friendship. Styles of disputes of beliefs are 1. Socratic, asking open-ended questions. 2. Didactic, teaching mini-lectures, analogies. 3. Humorous, note that humor can differ from person to person, or culture to culture. 4. Metaphorical. For more information on cognitive dispute types and styles, see videos on this YouTube channel, REBT Education and Training. I hope you found this video helpful in terms of working more effectively with inferences and beliefs in rational emotive behavior therapy. For more information on this model, simply go to the website of the Albert Ellis Institute.